Good afternoon, and welcome to our monthly installment of Universal Family Connections Risk Reduction Program. My name is Jeffery Jones. I am the Risk Reduction Manager, Universal Family Connection, and I'm here with my lovely co-worker, Lade.
Hi, good afternoon, everyone. My name is Lade Ademosu. I'm with Universal Family Connection, has been introduced. It's nice to see you all again.
And it is.
Yeah.
We've been having a great summer, Lade and I, and Juliet as well. She sends her hello. And so we've been testing all over the city. You know, back in June, we did our National HIV Testing Day. I think we did, we partnered with Walgreens, which does it every year on June 26th, 27th. And we did a great deal of getting out information, talking about HIV and AIDS, as well as hepatitis C, and meeting some of you, our neighbors. And so today, we just want to kind of update you a little bit on what we've been doing, and want to talk about what we have coming up. So, you know, the kids go back to school.
Yeah.
Sometime, some of them are here. August, they're starting, and then some are going back in September.
End of August and
Right.
Early September.
And
Yeah.
so we're going to be attending lots of back-to-school programs, doing HIV testing.
Yeah.
We might even get a chance to do some vaccines. We don't know. But we will be doing HIV testing. We'll be passing and distributing condoms. We'll be talking to the youth, especially. And that's what our program is about today. That's what it's going to focus on in a few minutes.
Yeah.
I just want to catch you up on what we've been doing. And this Sunday, which was August 3rd, 1st, 2nd, and 3rd.
Yes.
Lade and I, along with our colleague Juliet and the Illinois Department of Public Health, showed up at the Black Women's Expo this year.
Yes.
We had fabulous turnout. We distributed so much material.
Yes.
I did some testing, got out some great education, and just met a lot of people that asked us about our new medical mobile unit, which we acquired through the Illinois Department of Health and Human Services in December of this year. We're going to have to bring a picture of our mobile unit for you guys to look at. So we were there with that over the weekend. We also, where else did we go, Lade?
We have done some community events.
Right.
Like the Bright Star.
Bright Star
About
over
2
there
weeks
in
ago.
Cottage Grove at the Bright Star Center.
And we did something with Queen's Initiative.
Right, the Queen's Initiative that's sponsored through the Illinois Department of Public Health as well. So we've been really busy.
Yeah.
We only saying that because we want you to know if you see our van or us in your neighborhood or community or wherever, you can contact us and we'll bring the van out, we'll bring our team out, and we'll do education, we'll do awareness, we'll do HIV testing, we'll pass out condoms and whatever else we can do to make your event a success.
Yes. During the Black Women Expo, we actually had a lot of more contacts for people that are coming up with events, and they were so delighted.
Exactly.
They will be to have us to come and test at churches, at events, you know.
Exactly.
So that's a great thing, especially for the youths, especially because the rate of infection is alarming right now.
It is.
With the youths, so we want to address that and how they can get help
Exactly. And so if you want us to come out, the Universal Family Connection is a 49-year-old program. We were started in 1976 by our founder, Dr. Lorraine Broyles, and we've been doing this for over 48 years, almost 49 years. Mm-hmm. Well, we're going into our 50th year.
Yeah.
And so we have experience in this. We've been in as part of the HIV as long as they've been around. And so you can know that we're culturally competent, we're concerned about your issues, and we can be contacted. You can write this down. We're at 773-881-1711. That's our phone number. I don't know if you can put that on the screen. Our phone number is contact is 773-881-1711. That's gonna and we're located in the Beverly community at 1350
West 103rd Street.
Yes.
60643. We also have our sister office at 7949 Southwestern, where we go there on Wednesdays to test as well, to provide service to the community. So you can come in and test. You can call us for events. We will be there.
Right.
Just to spread the awareness and to provide education service.
Exactly. And last but not least, we have the Bud Billiken Day Parade coming up this Saturday. Mm-hmm. I don't know, we were invited. I don't know if we'll be there, but hopefully we got our fingers crossed that we will be there. So I look for Universal Family Connection on this Saturday at the Bud Billiken Day Parade or at the festivals in the park. Okay, so we're going to jump right into our topic. Lade and I have talked about really addressing youth since we are going back to school. When we say youth, we're talking about college-age students as well as high school and elementary school, because we know that in this this demographic, these numbers are steadily rising in our community for not only HIV or not HIV, just we have a number of sexually transmitted illnesses that they're being treated for. Chlamydia, gonorrhea, syphilis are all on the rise. And so we want to make people aware, that that it's out there. You can have some responsible, safe sex, but there are some things that you need to do and you need to be aware of it.
Yes.
Go ahead. And
you need to know that HIV is having a significant impact on young people. Now, the percentage is rising drastically, especially with high school students, and especially between age 13 and 24. They are like the largest percentage right now. The youths, at least, and we can, these disparities can be addressed by the health organization, healthcare system, the school system, you parents, and individual as well. Because it takes a whole village to raise a child, as they say. So we know that healthcare system can, spread the awareness. They can also encourage youth to test.
Yes.
During their physical, not even physical, we can go to the schools, which UFC have been doing. And during the Black Expo, we met with these two schools are willing now.
Exactly.
When they are one of those charter schools.
Yes.
They are so excited that we can bring the mobile unit to test students.
And that's one of the reasons why we just want to be at so many events, so that we can continue to get the word out. Yes, we're talking about it. They say the incidents are increasing among young gay and bisexual men. So this is about sexuality too, who people see themselves as and how do they fit in the world, and what pronouns they use and those types of things. And so we deal with those issues and we talk about it in a way that makes them feel proud of who they are and not afraid, because a lot of people are really still has this stigma about even taking the test, let alone coming back positive. They have a stigma about even showing up at the van or the mobile testing unit saying, "Hey, Jeffrey, I want to take a test," because it's not who you are that puts you at risk. It's your behavior.
Yes.
And we don't judge or anything like that. We're just going to give you the information. Sure. We just give you the facts. We're going to give you the test. How does the test work, Lade?
The test we're offering is actually rapid result test, which they get the result in 10 minutes.
Yes.
10 to 12 minutes.
Yeah,
they were surprised at the expo. Some were like, really? Get the result now? Yes.
Exactly.
And some were able to take picture of it, so proud that they were negative.
Exactly.
And so it can be for you youths as well. We understand that a lot of youths don't want to know. And that's because there's not much encouragement. And that's why I mentioned schools, policies, even the government policies can help too.
Right.
And as well as parents as well, because when you encourage them, a lot of youths now, they are very careless and they are undiagnosed as well. There's a huge percentage of youths who they don't want to know. They don't want to test, and if you don't test, you don't know. How can you get treated?
Exactly. So and it's not just the youth, but that's who we're focusing on today. They say that the largest percentage of new infections occur among those who are aged 13 to 24, black males mostly, who are in the gay lifestyle or same gender loving. Somebody said, like a lot of said, youth are least likely to experience the health and prevention benefits of treatment because they don't know their status. As a matter of fact, we were reading that nearly half of the young people with the HIV, they go undiagnosed. Yes. And you can know your diagnosis. I know it's scary. I know it is a scary thing. We have a support group that meets once a week, and we go in depth about HIV and how you felt when you were diagnosed and how you're living your life now. And some of the youth, I remember one of my first clients, and this was 20 years ago. She was very young. Older male partner had infected her, and she was telling me how afraid she was. And imagine this was 20 years ago. But even now, there's a stigma around getting tested and around knowing about HIV. But the more that we talk about it and the more that we test and give you your results, you can know that there is treatment. There is effective treatment. Yeah. And it's not expensive. It is expensive, but the state of Illinois provides what they call ADAP, and that's Age Drug Assistance Program. Say it again. ADAP, Age Drug Assistance Program. And they help you pay for the medication. They'll pay for it for you. And it's effective. It is effective in putting your HIV in remission, and you can live your life as though you don't have the HIV. You can be what they call undetectable. Undetectable means that even with the HIV test, your blood, the virus is so low in your blood system that it can't be detected by certain tests, and that you cannot pass it or you cannot transmit HIV to your partner. So they say they have a campaign that's called Undetectable equals untransmittable. Right, so you can still love who you want to love and still,
can you believe it's estimated that 44% of youths with HIV do not know they are infected. And testing is the first step to know. So that's why we're encouraging and spreading the education for you. Just test, especially if you know you have unprotected sex. After 28 days, you can get the test, the accurate test, whether you are exposed or not. And there's also a medication available at emergency hospitals, PEP, that even if you have exposed sex, you can go there and get the medication. It's for 7 days. Just if you to catch it on time if you are exposed. So, I mean, we are encouraging, once you know your status, you get linkage to care. You are referred to be in care of the doctor immediately. So always, please, youths, we are pleading to the youths, please be aware of your status.
Of your status. And we, update your status. If you know that you are in a lifestyle that you have unprotected sex, no judgment, we keep saying that. We're not going to call you promiscuous. We don't care how many bodies you have, any of that. We just know that we want you to protect yourself. One of the ways that we really want to start talking about more and more is a pill that you can take if you're not negative. if you're not positive, it's called PrEP. It's prophylactics exposure. And that's the pill is to keep you from becoming positive. So if you know your partner is positive, or that you just in a lifestyle where you're having unprotected sex indiscriminately, you can take the PrEP pill. Your doctors will prescribe it, and as long as you're taking PrEP, it keeps you from contracting the virus. So you should look into that. We can refer you to providers that will get you on the PrEP and monitor you and make sure that you remain HIV negative. I think it's something that everyone that knows they're out there should consider. And I know in your mind, just like my mind, you're thinking, well, what about the side effects? Well, what about the side effects of doing nothing? Because one of the side effects could be HIV diagnosis. One of the side effects can be AIDS. And so we want you to be better safe than sorry.
Yeah. And it is also estimated that those who do not know they have HIV accounts for about 1/3 of all new HIV transmissions. And those who are diagnosed but not in care, as in case with many youths, account for about 60% of new transmissions. Did you know that? That's something, It is these youths are at least likely to be experiencing health benefit of HIV treatment if they really, if they know, if they that they will. That's what the article says. That treatment and the reduction in viral load reduce HIV transmission.
Exactly.
Current epidemiology. This is it's right here on page. There.
Okay.
It is that was actually highlighted from the article, and it's amazing because when I was going through it, I'm like, oh my God, how do we help the youths? How do we encourage them? The prevention education it's very, very important. First of all, through schools, through schools will be a very important stream, an important point of contact.
And if you are an administrator, if you're a social worker in our schools and charter schools and CPS, and you're watching this or you hear about it, please give us a call. Again, we're in the Southside of Chicago, in the Beverly area, and we have a mobile testing unit. We'll come out. Just give us a date. We'll come out, and we'll come out monthly. We'll come out bi-weekly. We'll test everyone in your school that wants to be tested.
And we also provide prevention education as well.
Exactly.
Which is why we said some schools adopted the system based on the policies developed by Center for Disease Control. And then parents are also great impact, on kids.
Right, and we have to keep talking about this. I know a lot of people think HIV is over with, and we got so many things that's going on in the news that they grab our attention, and we should pay attention to it all. But parents, you really need to pay attention to your teens. Yes. You need to talk to them. If you don't know how to talk to them about sex, or you don't know how to talk to them about HIV. Allow us to come in, advocate it through your school. Call the principal and let them know, hey, I do want them to at least learn or know about HIV, how it's transmitted, some of the numbers, what they can do to stop it, and we help with abstinence as well. So that we don't talk about just having sex and how to reduce your risk. We talk about abstinence as well, because abstinence is the number one way to make sure you don't get HIV. So that's important. Then we talk about, how HIV can be contracted even through these tattoo parties that they go to. So it's a lot of ways. There's a lot of things that we share and talk about in educating our youth, and we're going to keep talking about it. We have we do walk-ins Monday through Friday from 9 to 5.
Provide condoms, pamphlets, anything to educate you. And most of all, you are free to talk to counselors, testers, and, whoever is providing the education on how to protect yourself, prevention education, basically. So just don't be shy.
Don't be shy. You
Reach
can
out
visit
to us at 773-881-1711, extension 1221, and extension 1157.
And our website is universalfamilychicago.org. Universalfamilychicago.org. Give us a call and schedule us to come in and speak with your youth or your church group or whoever you feel like can learn from this information. We thank you so much. We'll be back again. We're here every first Wednesday of the month. We'll be back next in September, the first Wednesday.
And if you have a topic you would like us to address, you can always reach out to us.
Yes.
And we will definitely bring it forward.
Feel free.
Thank you.
That's going to be our program for today. Thank you for tuning in.